Welcome to Lesson 4. So far this week, we've focused on understanding problems using digital epidemiology, AI tools, and primary data collection. Today, we shift perspective. Instead of asking what's wrong with this community, we ask what's strong in this community. This is asset-based thinking, and it's not just feel-good optimism. It's a practical approach that leads to more sustainable, more effective interventions. Communities solve their own problems using their own strengths. Our job is to see those strengths and build on them. By the end of this lesson, you'll accomplish three objectives. First, apply asset-based community development principles to your work. This framework offers a fundamentally different way of engaging with communities. Second, identify and categorize community assets across multiple domains. Assets aren't just organizations. They include individuals, associations, institutions, physical resources, and more. And third, integrate community strengths into intervention planning. This is where asset mapping becomes practical. We design programs that leverage what's already strong. Let's start by understanding the problem with deficit-focused approaches. Traditional needs assessments focus almost entirely on problems. What are the health issues? What are the barriers? What's missing? The result. Communities become defined by what's wrong with them. They're the community with high diabetes rates, the neighborhood with no grocery store, the population with low health literacy. This framing creates dependency on outside solutions. If the community is defined by problems, then solutions must come from outside experts who can fix those problems. Meanwhile, existing resources and resilience are ignored. Every community has strengths. Every community has people who are already solving problems, but deficit-focused assessments don't see them. Worse, this approach can undermine community efficacy and motivation. When you're constantly told what's wrong with you, why would you believe you could solve your own problems? Asset-based community development, often called ABCD, offers a different starting point. Start with what's strong, not what's wrong. Before cataloging problems, catalog strengths. Every community has assets that can be mobilized for health improvement, people with skills, organizations with resources, physical spaces, cultural traditions, existing relationships. ABCD holds that sustainable development happens from the inside out. Change driven by external actors rarely lasts when those actors leave. Change driven by community members using community resources is more likely to sustain. This doesn't mean external resources are unwelcome, but they should augment, not replace, internal capacity. We bring resources to strengthen what the community is already doing, not to impose outside solutions. Assets come in many forms. Individual assets include skills, knowledge, and lived experience. The retired nurse who could lead health education. The community member with diabetes who understands the daily challenges. The young person with social media skills. Associational assets are the groups and networks people form. Faith communities, sports leagues, parent groups, cultural associations. These groups have trust and reach that outsiders can't match. Institutional assets include organizations with resources and reach, schools, hospitals, libraries, government agencies, parks departments. Physical assets are the tangible resources, land, buildings, parks, community centers, transportation infrastructure, and economic assets include local businesses, employment opportunities, and the collective purchasing power of community members. Each category offers different possibilities for health improvement. Let's dig deeper into mapping individual assets. What skills do community members have? You're not looking for professional credentials necessarily. You're looking for practical abilities, someone who can cook, someone who can teach, someone who can organize events, someone who can fix things. Who are the natural helpers and connectors? Every community has people others turn to for advice or support. They may not hold formal positions, but they're the go-to people. Finding them is crucial because they can reach people you can't. What lived experience exists? People who have navigated the health system, people who have managed chronic conditions, people who have overcome challenges. This experience is an asset for peer support and authentic communication. Methods for mapping individual assets include surveys that ask what skills you'd be willing to share, community conversations where people identify each other's strengths, and observation of who's already helping. Mapping associations and institutions requires systematic cataloging, list existing groups in the community, faith communities of all types, cultural organizations, recreational groups, advocacy organizations. Understand what each organization already does well. A church might already run a food pantry. A cultural center might already provide social support for newcomers. A sports league might already bring together people across different neighborhoods. These existing strengths can be leveraged for health. Identify potential partners. Which organizations serve populations you're trying to reach? Which have missions aligned with health improvement? And map relationships between organizations. Who already works together? Where are the existing collaborations? These relationship maps reveal where coordination is easiest and where gaps exist. Physical and economic assets are often overlooked in health planning. Identify spaces in the community, parks, community centers, schools with evening availability, faith community spaces, even vacant lots that could be transformed into community gardens. Assess infrastructure. How does transportation work in this community? Is it walkable? Are different areas connected? These physical realities shape what interventions are feasible. Map the local economy. What businesses operate here? What services are available? Where do people work? Local businesses can be partners in health improvement, hosting health screenings, promoting health messages, offering healthy options. And a key question, what resources are underutilized? A park that's empty, a community center with unused evening hours, a business with space to spare. These represent untapped potential. Mapping is only useful if it leads to action. Connect the assets you've identified to the health priorities from your needs assessment. Ask explicitly, how can this strength address this need? The retired nurse you identified as an individual asset. Could she lead a chronic disease self-management program? The faith community with established trust. Could they host health screenings or promote health messages? The underutilized park. Could it become the site for community fitness programs? Design interventions that leverage existing assets. Instead of creating new infrastructure, use what exists. Instead of building new relationships, work through existing networks, build on what's already working. If a community organization already does something related to your health goal, strengthen what they do rather than starting a competing program. The real power comes from braiding multiple assets together. Combine assets for greater impact, that retired nurse, plus the faith community space, plus the cultural organizations network. Together, they create a trusted health resource that none could create alone. Create mutual benefit. Interventions should strengthen the assets they use, not deplete them. If you partner with a community organization, help build their capacity even as they help you reach your health goals. If you use someone's skills, ensure they gain something valuable in return. Sustainability comes from community ownership. When the grant ends, what remains? If the intervention was built on external resources and outside expertise, it collapses. If it was built on community assets and community ownership, it continues. This is why asset-based approaches matter for long-term impact. Let's summarize our key takeaways. Deficit-focused approaches, while well-intentioned, can undermine community capacity by defining communities by their problems and creating dependency on outside solutions. Every community has assets across multiple domains, individuals with skills and experience, associations with trust and networks, institutions with resources, physical spaces, and economic resources. Asset mapping reveals these strengths, which are often invisible to outsiders. The retired nurse, the trusted faith leader, the underutilized community center. Effective interventions leverage existing assets rather than importing solutions. They build on what's already working, and sustainability comes from community ownership, which happens when programs are built on community strengths. In our final lesson this week, we'll synthesize everything into coherent problem statements. Thank you.